Hey guys, hope you're having a great day. Today we are going to be talking about your pregnancy week number 7. We're going to talk about all the growing and developing that your baby's doing. Before we get started, I'd like to introduce myself if you are new here. I'm Shannon. I'm a certified nurse midwife and I specialize in obstetrics and gynecology, and I've been providing care to women for the past 23 years. If you are pregnant or you plan on becoming pregnant or you know someone who's pregnant, go ahead and drop a comment below. Let's see where you are in your pregnancy, or if you feel like this information may be helpful to a new mama or a first time mom, go ahead and share it. I like to get the word out so that we can make sure women are educated about what's going on in their pregnancies. And without further ado, let's get going. During week 7 on ultrasound, you will get what we call a crown rump length. So crown to rump, we will measure your baby, and that will give us an estimated gestational age and the estimated due date. Your baby measures about the size of a raspberry. This is about 10 millimeters or 1 centimeter. I think this raspberry is a little on the larger side. But this is average size of baby. Your baby's bones are developing. They're not hard bones. They're still nice and soft, but they are developing. Baby's eyelids are developing. Your baby's genitals are developing. Long ago, when the sperm met the egg, your baby's gender was decided. Now those genitals are starting to form. Your baby's inner ears are starting to develop, although you can't see it on the surface. Everything underneath is going on. At this point, the head grows larger than the rest of the body because the brain is rapidly developing and it needs extra space. The arms and legs begin to lengthen, and at the end, it begins to flatten out, and that's where the hands and the feet will be. Your whole uterus is about the size of a lemon. Not real big, but trust me, it's going to continue to grow and get larger, and you won't even be able to remember how little you were. Things you need to do during this pregnancy: continue to take your prenatal vitamin, make sure that you're exercising at least 30 minutes a day, avoid alcohol and smoking during your pregnancy. During pregnancy, no amount of alcohol is safe. Avoid marijuana because this could potentially be damaging to your baby's developing brain, and you might not see any outward symptoms right away, but studies have shown long-term developmental issues due to marijuana use in pregnancy. You want to make sure that you continue to eat nice, healthy, well-rounded meals. If you have high blood pressure, make sure that you're checking your blood pressure and keep a blood pressure log to take with you to your doctor's office. If you're diabetic, make sure that you're checking your diabetes medication. If you have an endocrinologist, you want to maybe reach out to your endocrinologist and let them know, hey, I'm pregnant. What do I need to do? Do I need to adjust medications? Do you want me to do anything differently? So these are some things you can kind of be proactive with if you haven't had an OB visit. What you can do to help with symptoms you may be feeling: increase your water intake. This can help with nausea. It can help with constipation and just overall well-being. Rest as much as you can to help with the fatigue. Your body is working so incredibly hard right now, and it can make you extremely tired. You may notice that when you're brushing your teeth or doing your oral care that your gums are bleeding, or they're a little more tender, or your gag reflex is a little bit more prominent when you're brushing those back teeth. Make sure you keep up with your oral care. If you're due for a dentist appointment, call your dentist and go in. Likely, they are going to ask if you're pregnant. They're going to want you to have a letter from your gynecologist stating that you're pregnant, that it's okay that they provide you with dental services. I hope this information is helpful. And if you have any questions about where you are in your pregnancy, anything that's going on that I didn't mention, drop me a comment below. There's such a wide range of responses that women can have to pregnancy. And let me know if you have something that's odd or not common so that we can kind of see and let other women know that this potentially could happen. I hope you guys have a great day, and I'll see you next time.